Welcome to this video. In this video we're going to talk about the cardiac cycle and cardiac electrophysiology. This video is going to be placed in the playlist on the cardiovascular system, so if you're struggling to find the other parts of this video, that's the playlist that you can look for them. Okay, so what are we going to discuss here then? Well, we're going to discuss the cardiac cycle, and then what we're going to discuss is how the cardiac cycle is actually coordinated, so by electrical signals that are going to propagate through the heart. So we're going to talk about the cardiac action potential in both pacemaker cells, such as the sinoatrial node and the atrioventricular node, and also in the normal average cardiomyocyte. And we're going to coordinate all of that together, put it all together to get a complete picture of how the heart actually coordinates the cardiac cycle. Okay, so to begin with, what I want to do is a revision of the anatomy of the heart. And really the reason I'm going to do this is I'm going to be using a very simple picture throughout this video on the cardiac cycle and cardiac electrophysiology for the heart. And what I want to make sure is clear in everyone's mind is exactly what this picture is showing in terms of a picture that is more anatomically true to the heart. So I will start by showing you the picture that I'm going to use throughout the video, which is very simple to draw and very easy to look at. But I want to be absolutely clear, I want to make it absolutely clear to everyone what the picture is actually showing. Okay, so let me start by showing you the picture that I'm going to be using throughout this video. So the picture I'm going to be using throughout this video for the heart is going to be a cross-section, and I want to show you exactly where it's a cross-section of. Okay, so here is the heart here, and all I'm going to do is put in 4 separate chambers here. So here is one of the chambers, that's clearly the right atrium. Here's another chamber, that's the left atrium. Then we'll have the third chamber here, the right ventricle, and a 4th chamber here, the left ventricle, like that. So we'll just label these up. We'll label this one up RA for right atrium, this one up for left atrium LA, this one up for right ventricle RV, and this one up LV for left ventricle. So that's the picture that I'm going to draw throughout this video for the heart, and I hope you'll agree it's a very nice simple picture, easy to draw, and that's why I'm going to be using it. But I want to make sure right away that people know exactly which cross-section of the heart this actually is looking at. So what I'm now going to draw is a picture that will take me a lot more effort to draw, but is more anatomically true to what the heart actually looks like. So I'm now going to draw a picture from the anterior view of the heart. So if you open someone's chest and actually looked at the heart from the front, what you would see. Okay, so firstly, right at the front you'd have the right ventricle with the pulmonary trunk, so that's where I'm going to start. And this picture might go horribly wrong, so I'm taking a risk in drawing this. So this is supposed to be the right ventricle here, with the pulmonary trunk coming here, and I'll add on the 2 pulmonary arteries later on. Then what we need to put in here is the right atrium, and we'll have the superior vena cava coming down and feeding into the right atrium there, and I'll just add on the inferior vena cava here coming in and feeding into the right atrium here. So this is the inferior vena cava, so we'll label things up as we go. So this is the IVC, inferior vena cava. This here is the superior vena cava, again feeding into the right atrium up there. Okay, and now obviously we need to add on the left side of the heart, so we'll start with the left ventricle. So I'll come round here, and all of this is going to be left ventricle. And then the aorta will be in between the superior vena cava and the pulmonary trunk here. You see the left ventricle will go behind the right ventricle where we can't see it. So if I was to take a drill and drill through the right atrium here, I get to the left ventricle, sorry, the right ventricle, this is not the right atrium. If I was to take a drill and drill through the right ventricle here, I would get to the left ventricle after I drilled through the interventricular septum. And so the left ventricle goes behind, and then what you've got coming out up here will be the aorta. And to make it very obvious that this is the aorta, I'll have it looping around in the great aortic arch here. like so. So there's the aorta coming from the left ventricle, and now all we need to do is finish this off by putting in the left atrium, which I'll have sort of beginning here, and of course into the left atrium we'll have all 4 of the pulmonary veins. So there are the 2 left pulmonary veins from the left lung. There will also be 2 right pulmonary veins coming in from the right lung. Okay, so have I got everything that I want to put on there? I think so. I'll just finish this off by having the pulmonary trunk split into the right and left pulmonary arteries there. Okay, so this is a picture that is more anatomically true. This is what the heart, well, this is more like what the heart would actually look like if you had one sitting in front of you, if you opened up someone's chest and were to look from the front. Okay, it's not quite perfect because the 2 atria look a little bit far apart, whereas of course they're really continuous with one another. But it's a reasonable representation of what the heart actually looks like. Okay, so how do these 2 pictures relate? What is this one in terms of this picture? Well, this is why I really wanted to do this first bit, so that everyone is absolutely clear with where this has come from. This is a complicated cross-section. What you have done is effectively you've chopped through the heart at this bizarre plane, the sort of plane that I'm making my hand at the moment. You've chopped through the heart like so. You've taken a knife and you've chopped through the heart, and this is now the exposed surface that you've generated, and of course you can see all of the 4 chambers there. And as I say, the plane that you've sort of done is you've gone in at this sort of, it's not one of the nice planes. It's not the sagittal plane or the coronal plane or the transverse plane. It's a bizarre sort of diagonal plane like this, and I'll try and sort of mark it on here at risk of ruining the picture. It's this sort of plane, okay, that you've sort of gone in on, so that you get all of the 4 chambers shown on this picture. Okay, so it's at that sort of an angle, which is why whenever I draw this picture I will do it at this sort of slanted angle to represent the fact that this is this sort of slanted cross-section of the heart here. Okay, so before we move on then, what I want to do now is just label up all the portions on this picture, and then also trace through the path that the blood is actually going to follow. So before we actually begin the cardiac cycle and talk about which bit contracts when, I just want to trace the path that the blood will follow. Okay, so let's label up the portions. So what we've already done, let's add a bit of colour onto this. So we'll have the inferior vena cava in green. I don't have a blue pen, unfortunately. That pen ran out of ink a long time ago. Okay, so they're in green. The inferior vena cava and the superior vena cava are there in green. Here, of course, we have the right atrium. Okay, and I'll colour in the right atrium in purple. And we might, as well as we're labelling things up, talk about the path that the blood will follow. So of course the inferior vena cava and the superior vena cava will bring blood back from the systemic circulation, from all over the body. Okay, the superior vena cava brings blood back from the superior portion of the body, so the upper limb, the upper portion of the chest, the head, importantly. The inferior vena cava of course brings blood back from the inferior portion of the body, so the abdomen and the lower limbs. Okay, and it all then comes back into the right atrium here. Now, the atria of the heart, they do contract, they do have the ability to contract, and just to go back completely to basics, just because I want this to be as broad as possible, the reason the heart can contract is that the heart is made up of absolutely loads of little cells called cardiomyocytes, so I'll write that as a key word. Okay, so the heart is made up of loads of little cells called cardiomyocytes, and these cardiomyocytes are all sort of like a little rectangular shape. So if you do look down the microscope, even with a light microscope, if you stain your heart tissue with an appropriate stain, you will be able to see the individual cardiomyocytes, and they're a sort of rectangular shape. And of course, these rectangles will be, the way they'll be oriented is they won't sort of have their 2 ends here oriented so that they're facing into the heart. They'll be along the length of the wall. So what I mean by that is the rectangle will be like this, okay? Its length will be along the wall like this, rather than going perpendicular to that. Okay, and all of these cardiomyocytes when they receive electrical signals, and we will talk about these electrical signals, the exact nature of these electrical signals later on, when they receive electrical signals, what they can do is they can shorten their length, they can contract, they can pull their distal extremities, if you like, inwards so that they shorten in length. Okay, and of course, if you can imagine all of the cardiomyocytes in these walls all doing that simultaneously, the entire wall is going to get smaller, and therefore the entire heart is going to shrink down. And that's the principle of what the heart can do. It can contract. Now, of course, those of you who know anything about the cardiac cycle will know that it's not the case that the entire heart contracts at once. You don't get the entire heart contracting at once. The atria contract before the ventricles, and we'll talk about that later on. Okay, so there's the absolute basics as to why the heart can actually contract. It's made up of cardiomyocytes, which are all capable, when receiving electrical signals, to shorten their length. In this video, we will not actually talk about why it is that cardiomyocytes can shorten their length when they receive electrical signals. That will be the point where we stop. We'll just say, and now the electrical signal is here, cardiomyocytes contract. Okay, that process of the electrical excitation causing contraction is a fantastically interesting signaling process known as excitation-contraction coupling, and if you are interested in it, I have a video on calcium signaling. I have lots of videos on these sort of topics, but one that I can remember is that I have a video on calcium signaling, which I believe is in the playlist entitled Calcium Signaling, and if you watch that video, I'm sure we go through the exact mechanism in cardiomyocytes. We also do it in skeletal muscle cells and smooth muscle cells as well, because it all uses calcium signaling. So you'll learn all about that if you want to, if you go to watch that video. Okay, right, we're getting off topic then. Let's go back to talking about the anatomy and the path through which the blood will flow. Okay, so blood will come into the right atrium through the superior vena cava and the inferior vena cava. And I was talking about the fact that the atria, they can contract, but really the heart doesn't actually need them. They're just like an extension, if you like, of the superior vena cava and the inferior vena cava in the case of the right atrium, and the pulmonary veins in the case of the left atrium here. They're not necessary at all, and in other animals, notably one of the animals that I know about is in turkeys, you don't actually have the atria. They're not even present. You just have the two ventricles. And think about it. Do you actually need the atria? If you know anything about the cardiac cycle, think through it. Are the atria actually essential? They're not. Okay, they do contract, and we'll see that they do play a role in the cardiac cycle, but you can get rid of them and just have these attached to, have the superior and inferior vena cava attached to the right ventricle and the pulmonary veins attached to the left ventricles, and get rid of the atria full stop, and the heart would still do its job. The systemic and pulmonary circulations would still work. However, as we'll see, they do contract. They are there in humans, and we will see their role in the cardiac cycle. But what I am saying this for is that when we come on to the cardiac cycle, everything will be done, everything will be told, the entire story will be told from the perspective of the ventricles, okay? And that reflects the fact that the ventricles are the main portion of the heart. They're the portion of the heart that you really, really need, whereas the atria are just like these accessory bits on the sides. Okay, right, so let's go back to labelling bits up. So what will then happen is the blood will go from the right atrium into the right ventricle here. And I want to talk about the valves that are in between the chambers and in between the ventricles and the outflow blood vessels. Okay, so let's start by talking about the valve that is in between the right atrium and the right ventricle. So the valves that are in between the atria and the ventricles are known as the atrioventricular valves. So atrio pertaining to the atria, ventricular pertaining to the ventricles, so it makes sense, atrioventricular valves in between the atria and ventricles. Now, so there's going to be an atrioventricular valve on both sides. There will be the right atrioventricular valve between the right atrium and the right ventricle, and the left atrioventricular valve in between the left atrium and the left ventricle. Now, they have a different number of cusps. Okay, now what does that mean? Well, what's the job of a valve? fundamentally. Let's start off with that question. A valve is something that makes sure blood only flows in one direction. Okay, so a valve is going to be something at the opening between the right atrium and the right ventricle that means that blood can only flow in one direction, and of course that direction is going to be from the right atrium to the right ventricle. Okay, now the means by which you achieve this is you have flaps over the entrance. So if I was to, let's say I'm a little man, and I'm now going to stand in the right atrium looking down through the hole at the right ventricle, okay? It's not just an open hole. This is what you would see. You'd see, here's the hole, but instead there are flaps in it, like so, and there are actually 3 flaps. So these are tissue flaps here, or also known as the cusps of the valves. Okay, so you can call them the flaps of the valves or the cusps of the valves. Okay, so here is one of them in red there, here is the second one, and here is a third one. Now, I'm this little man standing in the right atrium. What I could do is I could push these cusps open. Okay, if I was to bash into this at high speed, they would open into the right ventricle, and I would be able to go into the right ventricle, and that's what the blood can do. The blood in the right atrium can move into the right ventricle by just pushing these cusps into the right ventricle. They open inwards, and therefore the blood can go into the right ventricle. Now, why are these a one-way system? Well, the cusps cannot bend back into the right atrium. They can only flap into the right ventricle. They cannot flap the other direction. Okay, they cannot bend back into the right atrium, and indeed if they can bend back into the right atrium, that's what gives rise to heart murmurs and things like that, where blood can go in directions that it shouldn't be able to. Okay, so in a healthy person, the valve here in between the right atrium and the right ventricle, which has these 3 cusps, should be a one-way system where the cusps can only flap into the right ventricle, and therefore blood can only go from the right atrium into the right ventricle. Okay, so there is a name for this, another name, a specific name for the right atrioventricular valve, and people use this name all the time. So it's the tricuspid valve. So if you hear people talking about the tricuspid valve, then that's what it means. It means the right atrioventricular valve in between the right atrium and the right ventricle. Okay, so the blood is going to come from the right atrium into the right ventricle, which I'm now colouring in red here, and it can only flow in one direction from the right atrium to the right ventricle because of the tricuspid valve here. Okay, right, now what's going to happen? The blood that comes into the right ventricle is then going to get pushed up into the pulmonary trunk here, which then splits into the 2 pulmonary arteries. Okay, so the blood has returned from the body into the right atrium. Now this is deoxygenated blood that has come from the body, of course. It doesn't have much oxygen in it. Well, it doesn't have enough oxygen to actually give oxygen out to tissues. It does actually have a lot of oxygen in it, but it doesn't have enough for oxygen to diffuse from it to the tissue, so it's not in a state where it can supply oxygen to the tissues. Okay, so we now need to deliver it to the lungs for reoxygenation. So that's what the right ventricle, well, that's where the blood's going to go after the right ventricle. So this big trunk that comes out of the right ventricle then, this is called the pulmonary trunk, and it quickly splits into, here, as shown here, the 2 pulmonary arteries. So one pulmonary artery will go off to one lung, so this is the left pulmonary artery going off to the left lung, and this is the right pulmonary artery going off to the right lung. So I'll just label this as pulmonary artery. Okay, in particular that one that the arrow is going to is the left pulmonary artery. So I'll colour these pulmonary blood vessels in yellow here. Okay, like so. So of course now what will happen is the blood will go round the lungs, it will get reoxygenated, it will get much more oxygen in it, and now it will come back to the heart so that the heart can then send it off to the rest of the body. Okay, so what's now going to happen is the blood will come back in these blood vessels over here, the pulmonary veins. Okay, and remember, this is the strange thing that you have to remember. The pulmonary arteries, those are the only arteries in the body that have deoxygenated blood. Okay, all other arteries in the systemic circulation, they have oxygenated blood in them. The pulmonary veins here, they're the only veins in the body which are going to have oxygenated blood in. All the systemic circulation veins are going to have deoxygenated blood in. So these are the pulmonary veins. Ooh, And before we go through this, actually, I want to go back to talking about the blood leaving the right ventricle into the pulmonary trunk. Sorry about this. Okay, so hold on there. We'll go back to that later on, because we've missed out a valve that I want to talk about. I was meant to be telling you about the valves. So we talked about the atrioventricular valve between the right atrium and the right ventricle, which is called the tricuspid valve. There is another valve, however, at the junction between the right ventricle and the pulmonary trunk. So now let's say my little man has moved into the right ventricle here, and he is now going to move into the pulmonary trunk. Again, there is a valve here to make sure that blood only flows in this direction, from the right ventricle into the pulmonary trunk, a one-way valve. Okay, now, the valves that are between the ventricles and the large vessels that they supply, because we're going to see that there's another valve in between the left ventricle and the aorta. So these valves in between the ventricles and their great vessels coming off them, they have a name. They are called the semilunar valves. Okay, because the cusps look like half moons. So these are called the semilunar valves. And these semilunar valves, both of them, both the one between the right ventricle and the pulmonary trunk and the left ventricle and the aorta, again they have 3 cusps. Okay, and to motivate the name, I'll try and draw the cusps as sort of half moons, like so. Okay, like so. And hopefully there wouldn't actually be a hole there, so let me sort of try and fix that. There we go. Okay, so I'll colour it in to make it look better now that I've messed it up in that way. There we go. So they look like half moons and hence are called the semilunar valves. Now, of course, there are 2 of these semilunar valves, one between the right ventricle and the pulmonary trunk and one between the left ventricle and the aorta. They have different names. So the one between the right ventricle and the pulmonary trunk is sensibly called the pulmonary valve, and the one which we'll see later between the left ventricle and the aorta, that's sensibly called the aortic valve. So again, these have 3 cusps. We're going to see one final valve in between the left atrium and the left ventricle, and that's going to be the only one that only has 2 cusps. Okay, so both of the semilunar valves, they have 3 cusps. Okay, so the blood's going to go from the right ventricle into the pulmonary trunk and then into the pulmonary arteries, and there is a one-way system. There's again one of these valves here, and again to talk you through how this achieves one way, these cusps can only fold inwards. So if you're a little man standing in the right ventricle, you can push them into the pulmonary trunk and move into the pulmonary trunk, but if you're standing in the pulmonary trunk, you cannot push them back into the right ventricle. Okay, and of course blood only pushes, it doesn't pull. Okay, so you don't have the option, if you're standing in the pulmonary trunk and your blood, of pulling the cusps back inwards. Blood isn't very good at doing that, it can only push. Okay, so it ends up pushing, and then the cusps say no, you're not coming through here, so it can't then go back into the right ventricle. Okay, so then what will happen is the blood will go round the lungs, it will get reoxygenated, and then it will come into the pulmonary veins. Now there are 4 pulmonary veins, I've only got 2 shown here. These are the left pulmonary veins. Both of them are coming back from the left lung. There will be another 2 on the other side, which will be draining the right lung. Okay, and then we've got the blood coming into the left atrium here. Okay, which again, really you can just think of it as a reservoir. You can think of it as a continuation of the pulmonary veins. It does contract, and that isn't trivial. It plays its part in the cardiac cycle and the cardiac electrophysiology. We do need to be aware that it contracts, of course, but as far as actually pumping blood around the body is concerned, the atria don't play that important role, and you could have just had the pulmonary veins draining into the left ventricle here, if I had to think then. Okay, right, so here then is the left ventricle, our final chamber of the heart. So what's going to happen is the blood is going to come from the left atrium into the left ventricle. Again, there will be a hole between the left atrium and the left ventricle, and again that hole will have a one-way valve there, another atrioventricular valve, and this is the only one of the 4 heart valves that has only 2 cusps, and therefore is called the bicuspid valve. So to draw a picture of what that would look like if I was the little man standing in the left atrium looking at it, trying to go into the left ventricle, it would look like this. 2 large cusps like so. Okay, and again I can push up against this and they will flap inwards into the left ventricle, allowing me to go in, but then they won't flap back into the left atrium, at least not in the healthy heart. They won't flap back into the left atrium, and therefore blood will be trapped in the left ventricle. Okay, so then the blood will come into the left ventricle, and I'm running out of colours. What should I do the left ventricle in? Green here. Okay, and from the left ventricle then it will go into the it will go into the major blood vessel that comes out of the left ventricle, which is of course the aorta. So the blood, of course, coming back from the lungs is all oxygenated, so now the left ventricle is going to send the blood into the aorta, and the aorta will send it all around the body. The body will take the oxygen and nutrients from the blood, and then the deoxygenated blood will come back to the superior and inferior vena cava. Okay, and of course in between the left ventricle and the aorta there is another one of these one-way valves, another semilunar valve known as the aortic valve, which prevents blood flowing back from the aorta into the left ventricle. Okay, so there's an overview of how blood flows through the heart, and also the valves of the heart, and also the anatomy of the heart. So this is the picture of what the heart actually looks like. This is the picture that I will be drawing from now on, so that we can discuss the cardiac cycle and cardiac electrophysiology, because this picture takes too long to actually draw each time. Right, so I think we'll have a break there, and in the next video what we'll do is actually talk about the cardiac cycle, by which I mean which bits contract at what times, okay, and how that all works together to actually deliver blood from the inferior and superior vena cava round the lungs and then off to the rest of the body to deliver the oxygen to the body. Okay, so I'll see you in the next video.